Hi, my name is Dr. Leo Trezon, and I'm a gastroenterologist, and I want to talk to you about an upper endoscopy test, which is also known as EGD, or esophagogastroduodenoscopy. And this is a quick, easy test that is done on an outpatient basis. It typically takes about 10 to 15 minutes, and we do it in an ambulatory surgery center so that you're comfortable during the procedure and you're actually somewhat asleep for the procedure. The reason we do it is to detect abnormalities of the upper digestive tract, which include the esophagus, the stomach, and the duodenum. Common things that we evaluate for would include abdominal pain, nausea, vomiting, upper gastrointestinal bleeding, anemia, abnormalities of imaging that suggest there's a problem in the upper digestive tract, and a whole lot of other reasons too. In general, your doctor refers you for a test like that, and you should meet with the doctor before to make sure you're of good fitness in order to undergo this relatively simple procedure. We do this procedure with an anesthesiologist so that you're comfortable and asleep during the procedure and that your gag reflex is suppressed and it's somewhat easier to do the procedure than with you being awake. And we do this near our office at an ambulatory surgical care center. And we would ask that you arrive 1 hour before the procedure to meet with the nurses and the anesthesiologist. You should come wearing comfortable street clothes such as sweats. And you should not bring any unnecessary things such as wedding rings, jewelry, watches. Just come simple. Upon arrival, you'll be asked to fill out some paperwork that describes your health history, and then we'll have you change into a hospital gown. The nurses will put an IV inside your arm, and the anesthesiologist will ask you questions about your health. We will confirm that you haven't eaten anything before the procedure, and typically we ask that you not eat any food for 8 hours before the procedure. And then between 8 hours and 4 hours before the procedure, you're allowed to drink water. And then for 4 hours before the procedure, up until time of procedure, you are not allowed to drink anything except possibly medications with a few sips of water, if necessary. So after you meet with the nurses and they put the IV inside your arm, the anesthesiologist will meet you and ask you questions about your health, things like your allergies, previous anesthetic experiences, and he or she will take a look at your airway to make sure you don't have sleep apnea or a dangerous airway for whatever reason. And then we'll start the procedure. We'll have you sleep on your left-hand side, and we'll put pillows and gel supports behind your back so you're really comfortable. We'll put a small tooth protector inside your teeth that keeps your mouth open as you sleep. After you get a medicine through the veins called propofol, the anesthesiologist will be monitoring you and making sure you're breathing easily on your own. When you're very comfortable and sleepy, I will put a thin camera inside the mouth guard and down the back of the throat and into the esophagus, stomach, and upper intestine. I will take pictures and biopsies, and if there's growths in the stomach or in the upper digestive tract, I will remove those growths. And then that procedure takes around 10 minutes to do, sometimes longer and rarely shorter. When we take biopsies throughout the procedure, we insert a small little probe called a biopsy forceps, and we take a small scraping of the upper digestive tract so that we can analyze it under the microscope. We send that specimen to a doctor called a pathologist who looks under the microscope and sends me a report, which I in turn will send to you. When I take the camera out, the anesthetic is turned off, and you wake up instantly. But you really don't remember where you're at or what just happened, so I like to wait around 20 minutes for you to come to your full senses. We'll give you something to eat and drink, and we'll have you change back into your street clothes, and then I'll come over and I'll examine you, and I'll tell you about what I found that day, and I'll give you instructions to go home with. I'll also write everything down, and I'll give you pictures to go home with, and then I'll follow up with a phone call later in the week, and I'll send you a report electronically that summarizes everything that happened, including the pictures and all the stuff. I'll also send a copy to your doctor that referred you, so you don't need to send your copy to your doctor because he or she will get a copy too. And that's it. You should know that this procedure is really safe. There's a few things you need to be aware of later in the day when you go home. You should not drive a car, operate heavy machinery, such as gym equipment, make important business decisions, such as signing a contract or giving legal advice, and you shouldn't do anything that puts you or other people in harm's way, such as playing contact sports, shooting a gun, riding bicycles. Next day, you're totally back to normal and you're feeling perfect. Usually you're feeling pretty perfect after the procedure too. You should know the procedure is really safe, and to have complications is very rare. But the known complications of endoscopic procedures include bleeding, infection, perforation, vomiting and aspiration into the lungs causing pneumonia, oral or dental or vocal cord injury, complications of anesthesia such as such as fast heart rate, slow heart rate, abnormal heart rhythm, and potentially even missed abnormalities somewhere within the digestive tract. And what that means is we will look for anything that looks funny and attempt to take a biopsy of it or remove it. But sometimes things are easy to miss even when they're right in front of you. And we will do our best to not miss those lesions. But even missed abnormalities are possible. So those are the risks of the procedure, the nature of the procedure, the indications, and its benefits. I hope that makes it clear for you, and if you have any questions, please give me a call or ask your doctor. Thank you very much.